Dr. Peter Glidden, your steadfast advocate for health. Today's the 21st day of May, 2020. And you know, any study of Central or South American politics will quickly convince you that absolute power corrupts absolutely. And that is exactly what's going on here in the United States vis-a-vis the medical industry. If I've said it once, I've said it 1,000 times. We haven't had a free medical market in the United States since 1912, when, under the influence and the persuasion of the Rockefellers and the Carnegies, the American Medical Association was granted by Congress exclusive control over who could and who couldn't practice medicine. This was the ascendancy of the MDs as the main architects, arbiters of all things medical in the United States. It was in effect a hostile takeover of the medical marketplace, and it's been there for so long, 108 years now, that most people are completely unaware that it even exists. It is a fait accompli that Joseph Goebbels, quite frankly, would be very proud of. And the position at the top has been maintained by the unbelievable largesse and political persuasion of the pharmaceutical industry. And, you know, absolute power corrupts absolutely. And so these are the manifestations thereof. The Food and Drug Administration is in complete control over medicine. And in the United States, by law, the only thing that can treat a disease is a drug. The only thing that can treat a disease is a drug. Now, who says? Well, the Food and Drug Administration says, and by the way, the members of the Food and Drug Administration, they're not elected, they're appointed. And the vast majority of the members of the Food and Drug Administration, when they leave public service, go to work for the pharmaceutical industry, which they were regulating. Absolute power corrupts absolutely. Who made the Food and Drug Administration king? Why is it in their purview to say what constitutes medicine and what doesn't? What constitutes a medical treatment and what doesn't? I'm a licensed naturopathic doctor. I graduated from a fully accredited naturopathic medical school. I passed national boards, state boards, got a license to practice medicine, have been accruing continuing education credit for the last 29 years, and my profession's treatment strategies are considered what? Quack medicine? Alternative medicine, quote unquote? Calling what we do alternative is like saying the only real dog is a Cocker Spaniel and every other dog is an alternative dog, right? And you would think that in this culture of woke politics, such derogatory terminology would have been exercised, but not in the field of medicine. And even though there is ample evidence from India, from Cuba, and from Brazil with government-sponsored homeopathic treatment strategies, homeopathic prevention, immunization strategies delivered to, I think, over 90 million people, government-sponsored, by the way, with unbelievable success rates. Statistically remarkable success rates, far in excess of the success rate of vaccinations. Even though these data have been published, the talk about homeopathic treatment for viral infections is verboten. You can't do that. Well, why is that? Because the Food and Drug Administration will tell you that homeopathic medicine is placebo. It doesn't work. It's quack medicine and should be outlawed. And it's not because it is quack medicine and it should be outlawed. It's because it's in direct opposition to the pharmaceutical agenda. An inexpensive, easy to make, science-based, clinically verified medical treatment that's more effective than vaccinations? You've got to be kidding me. I doubt very much that this video is going to last very long on YouTube or on Facebook because it will be censored out of existence, which is another manifestation of the monopoly. And you know, From my point of view as a licensed naturopathic doctor, this is a horrible situation. New statistics out of Illinois. About 15% of the population by extrapolation has been infected with the coronavirus. There have been a total now of 672,020 tests performed, of which 102,686 were positive. That gives about a 15% of the people who were tested are positive. So if you extrapolate that to the entire population, it's a lot of people infected with the coronavirus, and yet to date only 4,607 deaths, which means that the actual death rate from exposure to the coronavirus is 24/100%, which is 400 times less virulent than the seasonal flu. And yet, because of this, we needed state lockdowns, we needed national lockdowns. You've got to be kidding me. Who was it that got all of these data so, not just a little bit wrong, but so remarkably wrong? It was the MDs. It wasn't the chiropractors that got this wrong, or the osteopathic doctors, the homeopathic doctors, or the naturopathic doctors, or the acupuncturists, or the Ayurvedic practitioners. It was the MDs, and the Food and Drug Administration, and the Centers for Disease Control. They got it wrong. And yet, even though they have made such unbelievable errors and created so much human suffering, economic suffering, they get a pass. Because inside of a monopoly, it's good to be the king, and you can get away with whatever you want to get away because it's a self-policing, self-regulating industry. The members of society to which have been socialized to believe that it's the only valid medical treatment, and if the MDs can't figure it out, that nobody can. And this is a problem. I've had 3 patients so far with coronavirus, and none of them were sick for more than a week. None of them had to be hospitalized. They pretty much sailed right through it because of science-based, clinically verified naturopathic medical treatments. So why aren't members of my profession invited to the table, to the task force? Why isn't this happening? Why aren't all medical disciplines invited? Because we don't have a free medical market, and the Food and Drug Administration is in charge of everything. And who made the FDA king? I've said it before, I'll say it again. There is no reason that the Food and Drug Administration should have global say over all things medical. There shouldn't be. And now, everybody's talking about vaccinate this and vaccinate that, because it's a gigantic money grab. It's big, 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 big money that the Centers for Disease Control, by the way, gets a piece of that action. Did you know that? They have skin in that game. Did you know that? When in point of fact, it was concluded after the horrors of World War II by The Hague that any medical procedure without informed consent is against international law. Now, we know that there's a vaccine court in the United States. We know that the vaccine court awards millions of dollars in damages to people who have children or themselves who were vaccine injured. So we know that vaccination is not safe. By definition, vaccination is not safe, and that's even in the published literature that most medical doctors don't take the time to read. We know these things about vaccinations. And yet, even though there exist homeopathic vaccine solutions which have been proven with 90 million people over 3 countries to be more effective than vaccinations, pharmaceutical vaccinations, we're not going to consider that at all. We're going to go with the pharmaceutical method because we don't have a free medical market. And this is a problem. And you have to take one for the team. You have to get vaccinated, even though there's a chance that it's going to hurt you or harm you or put you in a wheelchair or whatever. That's okay because, you know, the needs of the many outweigh the needs of the few, and we all live in a society and blah, blah, blah. Well, look, the only way that this wouldn't be against international law is if there was complete informed consent. And in order to have informed consent, you need to do double-blind, placebo-controlled trials. And oh, by the way, none of the vaccines currently, which are in the vaccination schedule for children in the United States of America, none of them have been double-blind, placebo-controlled. None of them. Absolute power corrupts absolutely. Most people don't even know how to pronounce naturopathic, or let alone know what the training or the education or the clinical skills of a licensed naturopathic doctor are. And more's the pity here. Because more than ever at this moment in time, this is what people need to know. Because what it all boils down to, which even conventional medical doctors will agree to, is it's not so much the virulence of the virus as it is the health and the strength of the host. The people that are being killed by the coronavirus are people with pre-existing health conditions who were sick to begin with. And I would argue that they were sick to begin with because the only medicine that they had access to was MD-directed pharmaceutical centrist medicine, the intention of which, the treatment strategy of which wasn't to attempt to cure anything or bring those people into a state of health, but simply to manage the illness. So the blood pressure isn't cured, the heart condition isn't cured, the blood sugar issue is not cured, the obesity is not cured, it's managed. And this is what passes for the best medicine in the world. You've got to be kidding me. Orange is the new black, sickness is the new health. Everybody's sick, and I know why, was the title of my first book, and for good reason. Because as it turns out, conventionally trained MDs are really, 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 really good for trauma care, surgery when it's necessary, and a handful of infectious diseases. That's their wheelhouse. But for the things that most people go to the medical doctor for, most of the time, they have horrible outcomes. And the treatment strategies weaken people over time. So the older you get, the more drugs you're on and the weaker your body gets. And then you get something like the coronavirus and you go down for the count. And it's not because the coronavirus is a big killer. It's because you were really weak. Because you were taking the wrong dog to the hunt your entire life when it came to medicine. And why were you doing that? It wasn't any fault of yours. It was because of the monopoly. The only medicine that your insurance paid for, the only medicine that you had access to, the only medicine they make TV shows about, the only medicine they do research on at your alma mater is MD-directed allopathic pharmaceutical centrist medicine, which for epidemics is a horrible track record. And chronic disease. Numbers don't lie. You know, you're welcome to your own opinion, of course, but not your own set of facts. While the MDs have been in exclusive control over the development and the delivery of medicine, Alzheimer's has skyrocketed, autism has skyrocketed, obesity has skyrocketed, type 2 diabetes has skyrocketed. Heart disease rates remain the same. Just as many people get heart disease now as they did 80 years ago, but now medical doctors can keep patients alive after their third or fourth heart attack because that's their thing. Heroic intervention. And, you know, thank God for that. Thank God for insulin and the sterile technique and general anesthesia. It's fantastic. Every time I'm in the dentist chair, I thank God for lidocaine. You wouldn't believe the things that myself and my colleagues have seen our patients recover from. You simply would not believe it. We don't have the magic bullet for all human disease, but we do have a very sophisticated, science-based, clinically verified clinical strategy here, which leaves the MDs in the dust when it comes to epidemics and or chronic disease, which begs the question, why aren't science-based, clinically verified alternatives to the pharmaceutical method allowed into the public conversation? Why is it always demonized? Because we don't have a free medical market is the answer. Now, you know, if you're waiting for the laws to change, good luck. I don't think that's ever going to happen in our lifetime. Maybe President Trump will have a eureka moment and something will happen. I don't know. But if you have seen the light and you know that the best possible thing you can do for your health is to leave Big Pharma behind and to pursue science-based, clinically verified, licensed and regulated alternatives to MD-directed pharmaceutical centrist allopathic medicine, then you need to come to my website, riseupintohealth.com. I am gathering a worldwide coalition of the informed, coalition of people who have taken the blinders off and who see the limitations of conventional medicine and who are looking for alternatives which work. And you know, years ago in the United States, at the turn of the 20th century, we doubled life expectancy here, and it wasn't through the use of pharmaceuticals. It was by the government subsidizing farmers so that there would be more food available to more people, and it was public sanitation. Teaching people not to pee upstream and drink downstream. Doubled the population. Education and food. Most of the strategies that human beings need to employ in order to build health in their bodies, you don't need to go. You do not need to have a private appointment with a naturopathic doctor for. You just need a little bit of education. If you're smart enough to pass the driver's license test, then you are smart enough to learn what to do to stimulate, support, and promote your body's built-in God-given ability to be healthy. And this is what I've dedicated the last half of my life to public education. Teach a person fish is way better than giving somebody a fish, right? So go to riseupintohealth.com, avail yourself of the information that's there, become a subscriber to my online content, and join the growing coalition of people who are inspired to leave Big Pharma behind and become the heroes of their own health recovery. God willing, and the creek don't rise. I'll see you next time. I am and always will be your steadfast advocate for health, Dr. Peter Glidden. Live long and prosper.